Hey everyone, I'm Lauren Fleming, the founder of Hem Supportwear, and today our guest is Sophie Villeneuve, and she is a pelvic health physiotherapist and an online coach specialized in prenatal and postpartum care with more than 10 years of experience. She's the creator of the Beyond Birthing Signature Program, where she helps pregnant parents from all over the world prepare their pelvic floor for a smooth birth and postpartum recovery. And finally, she also provides free pelvic health education and tips for expecting parents on her Beyond Birthing YouTube channel. So, Sophie, we are so excited to have you here today, and we're excited to talk with you. We'd like to kick it off just with you telling us a little bit about your background and what inspired you to be in your role and do the work that you
Yeah,
do.
that's a good question. Basically, as pretty much any physiotherapist, I started as a general physiotherapist. And eventually, I was just looking for a specialty that I could do to, like, be very good at one thing. Because as a physio, you can do neurology, you can do ortho, like, there's just so many things that you can do. But I wanted to have, yeah, like just a specialty. And there was a friend of mine who was a pelvic health physiotherapist, and she was just like, Sophie, you need to look into this. It's so amazing how we help women with their quality of life. And, they share things with you that they haven't shared with anyone else. And then you're here, like, saying, we have solutions for you. And she says the reward from working with these women is just so amazing. So I was like, okay, maybe I should look into it. So I took the first course in Toronto, and it was instant love for me, like pelvic health. I came back home like with stars in my eyes, and I was like, man, this is like when you found the thing. And so I took more and more courses, and eventually how I got to specialize in pre and postnatal care is because automatically, I think when you do pelvic health work, you have a lot of postpartum moms who gave birth and have issues like urine incontinence, painful sex, low back pain, pelvic pain, diastasis recti, where the core has split during pregnancy. So, and we have here, like in my community, we have really like a community of young women who have families. And so automatically I was kind of thrown into that prenatal postpartum specialty just from having more demand from these women. And so that's how I got to take more training specifically in that field. And then eventually I just decided, you know what, this is my passion. I just really liked seeing women in pregnancy. They're often it's their first pregnancy. They come
Yeah.
to me for prevention work, and then I help them prepare for birth. And then postpartum, they come with their baby, and it's as if I'm part of the family. Like their partner comes in sometimes to learn some techniques to help for labor. And I really like that continuity of helping them through that whole journey, and sometimes even through future pregnancies they come back. So yeah, I found that it was special to be part of their team in that way. And yeah, eventually I just decided, you know what, this is something I will focus on, is just prenatal postpartum care. And then eventually with the pandemic, I think it stirred everybody's way of working, of course, as when you do in-person work. And I decided I would like to put this out there, like a prevention program for pregnant moms who want to prevent pelvic floor issues that often arise from labor, delivery, and postpartum. So during the pandemic, I created this online coaching program that is now available to anyone in the world. And it's just been so amazing to be helping people beyond my community and helping them, just having that knowledge to empower them with their pelvic health before they have issues, right? Because before, I think that was a thing. Like, I was seeing a lot of postpartum moms, but a lot of the time I was like, I could have helped them not have that,
Yeah.
right? If they
Right.
had known how to stretch their pelvic floor before birth, they might not have had a third-degree tear. If they had
Yeah.
known how to push their baby properly, maybe they would not have like a major prolapse. And so my interest was really, how can I prevent these things from happening by giving them that information and that power
Mhm.
in pregnancy. And so that's kind of how it all came together.
Amazing. Oh, and I love the beginning where it's like you come across something like where your friend says, "Hey, consider this space," and then it's just that like, yes, there's no question that this is the path for me. I mean, those are such powerful moments, and it's amazing, every time you get to experience one. So I think that that's really neat. And then having the extenuation of providing a program like yours for people who, so not everybody lives close to a pelvic physiotherapist or things like that. And so it's like, I love that, or maybe their schedules are really challenging. So I mean, of course, in person, like, there's nothing else like it. But at the same time, having those online resources, I think are so impactful, and they make this just even more accessible to more and more people, which, you just can't get enough of that. And I think your point too about the reactive and seeking help versus proactive is really impactful. I mean, I had a close family member who had a baby. It was her first one, and she got to the other side of it, and she was like, "I don't even think I like knew how to push." I mean, those were the kinds of things she was telling me, and you just realize how I think people's expectation is that is just part of the process, that you were either told those things or you might inherently know those things, and you
Or
don't
you are
realize
born
sometimes.
to give birth as a woman,
Exactly,
like everybody
exactly,
should be
right.
doing that like
Yeah,
this,
right.
right?
And that's really like hard, because I felt for her so much. I was like, yeah, you realize like how much advocating for yourself you have to do in education and learning that there can be to improve, your possible outcomes. So I think that your program's amazing, and that point about trying to be as proactive as possible, because a lot of these things can be, at least lessened, or and I think the knowledge is power too. Because I was one where I was connected with a pelvic health physical therapist, but I was still blindsided by my POP diagnosis. And thankfully, I already had connections in place. But I think that not, but just the knowledge and empowerment that that brings is also so important, so that when you do experience challenges, you feel more confident to seek out people like yourself, and just know that there's resources, yeah, to get help. So,
100%. And I think your point that you were just mentioning, people don't know and like think that it should be this natural thing that everybody should be doing. And like the argument is often women have been giving birth for thousands of years, right?
yeah,
And my response to that is always, but at what cost? Like we
right,
don't hear, if you ask your
right.
grandmother, like
Yeah,
how is it going down there for you? Like maybe
yep,
she'd be like, oh yeah, I'm changing my panties 3 times a day since I've
yep,
had children, right? Yes, she's still
right.
alive. Yes, she had like
Yes.
3 healthy children. But yeah, it's just that it's not talked about enough,
Yeah,
the impact of
right.
birth on the pelvic health. And
Yeah.
so it doesn't mean that because you have given birth, yes, you were able to do it, that's one
Yes.
thing. But like what have been the consequences on your
Yeah,
quality of life as a
yeah,
woman? And sometimes having to give up on sports that you liked, or
right.
not having sex with her husband anymore because it hurts too much. Like, do you think this is something that people talk about at their potluck dinner on a Saturday
Right.
night?
Yeah,
No.
no.
So,
No, it's not.
um,
For the most part, no. Uh, can you tell us a little bit what your day-to-day schedule looks like with the different ways that you provide these kinds of services?
Yeah. So right now I'm only working 1 day a week in the clinic with clients, and the rest of the time I'm providing online coaching. So
Right.
with the people who are in my program, it's an online program. So it starts in early pregnancy. Normally in the second trimester is a good time to get started. And then they have kind of an online program to follow
Okay.
at their own pace to prepare for birth, and postpartum, same thing. They have a full rehab program and lessons about symptom management that they can consult if they have anything that they worry about. But also, which I think is the main difference of my program versus maybe other programs out there, is that they have access to me as the
Mm.
pelvic floor physio. So they can ask me their questions anytime about their symptoms, what they should or shouldn't do. Like there's postpartum moms out there, they're like, hey, I've got these prolapse symptoms, and I don't know if I can even go for a walk with my baby. And there's a lot of anxiety about, can I do this for my pelvic health, but at the same time, I need it for my mental health, and that's always
Yes.
that balance.
Right.
So being able to speak with someone, and so we can kind of back and forth brainstorm, okay, what is going on for you? And then I can orient them better, especially if they don't have a pelvic floor physio that they're working
Mhm.
with. Or sometimes they're working with someone, but they're so booked that they can't get
Yes,
in until they're like 2 months postpartum. And the most
right.
symptomatic phase after birth is often the first 2 to 3 months. So yeah, the rest of the week, I'm either coaching online, recording YouTube videos for my channel. Yeah, so like all the
Right.
things that come with running an online business.
Yes, yeah, very it's a lot of hats to wear, I would imagine.
Totally. Yeah.
Great. How would you explain the importance of pelvic health to somebody that maybe, is kind of coming to it without a lot of knowledge?
So a pregnant mom or even someone
Yeah,
who might,
let's talk kind of more let's talk like either I'm planning to be pregnant or early pregnancy and I
Mhm.
don't know a lot about it.
Or even trying to conceive, you know.
Yes, yeah.
Um, yeah, so basically, the impact of being pregnant on your pelvic floor comes down to I'd say four things. Well, first, you've got all the hormones changes that make your body looser, because if you didn't have that, your belly would not expand to let your baby grow, right? So we are really thankful for these hormones to make everything looser so the baby can grow. But on the other hand, it will affect your pelvic floor and like all the ligaments in your pelvis. So because of that vulnerability from the hormones, then you're kind of more at risk of having pelvic health issues during pregnancy. That's one thing. Second thing is your posture is changing. So especially when we're talking second trimester, third trimester, our belly
Mhm.
bump is pulling us forward, and that changes the position of your pelvis, and that can apply different weird pressure on your bladder and on your pelvic floor. So that's another way that it affects it. Third way is you've got a growing baby right on top of your pelvic floor. And for people who don't know what the pelvic floor is, it's basically a sling of muscles. I wish I had my model here. It's a sling of muscles between your pubic bone, so the big bone at the front of your pelvis, and your tailbone. So it's all around your vagina and your anus. And so these muscles are there to support whatever is on top, which is the pelvic organs like the bladder, the uterus, and the rectum. But when you have a baby growing on top, then everything gets compressed, right? So that's a load that your pelvic floor needs to kind of uh, counterbalance. Um, Three, and then the fourth is kind of slipping my mind. Oh, well, it's not really pregnancy, but labor and delivery itself,
Yeah.
right? Like, because if you give birth vaginally, your pelvic floor will need to allow your baby to come through, right?
Mhm.
Because the pelvic floor is around the vagina. So the impact of that on the integrity of the pelvic floor is, of course, something to consider. And that's why postpartum we might have more pelvic floor issues like bladder leakage, prolapse. If you don't know what a prolapse is, it's when one of the pelvic organs is falling in the vaginal canal. And you, Lauren, probably know a lot
Yep.
about that because
Yes.
you're providing people with options to help support the pelvic
Mhm.
floor with some compression garments, right?
Mhm. Yep, that's
Um,
right.
so um, so yeah, basically all of these things impact your pelvic health. Maybe you'll get lucky with your first child and you'll be like, I've done no physio at all and things were always fine down there. Good for you. I would say it's not the majority. So
Yeah.
if you're not doing any preventative work, like looking into how can I help my pelvic floor to give birth without injuring itself, then you might end up with severe tearing, pushing for longer than you should, which can develop a prolapse. You could also have like trouble pooping after birth, having back pain because the pelvic floor supports the pelvis and the lower back. So all of these different issues can be linked to pelvic floor dysfunction. So that's why having a preventative approach, like saying, okay, I'm pregnant right now, I would like to do the best I can to preserve my pelvic health, can be very powerful because this is something that you can actually learn to um, like prevent all of these issues.
Mhm. Yeah, a lot of compelling reasons for why it's important to consider
Totally.
it, especially during, yeah, pregnancy and birth and postpartum for sure. What are, one or two misconceptions that you still hear about that are really pervasive that you wish we could kind of overcome, in this conversation?
One big one is like if you leak urine postpartum, it's normal and it's often kind of dismissed, right? If
Mhm.
you go to your, and I mean, I don't want to put everyone in the same basket. A lot of doctors now are aware of pelvic health and the importance of pelvic floor physiotherapy and send their patients to a pelvic floor physio if they have these symptoms. But if you have an older doctor, maybe, or someone who doesn't believe in pelvic floor
Mhm.
physio, and you go to them, a few weeks after delivering your baby, and you're like, hey, I'm peeing my pants every time I laugh or cough, or if I'm going for a run, and they're like, well, you've had kids, this is going to be it right
Yeah.
now, like, or go for a bladder surgery, right? It's often like
Yeah. Yeah.
what is the only option they propose, and I totally disagree with that because
Mhm.
when you think about it, would you say to an athlete who broke their ankle, like, well, you're an athlete, like this is the way it is, you're going to injure yourself, so just live with your injury? No. Like, you would tell
Right.
them, go see a physio, go heal
Yeah.
yourself. There's a rehab process to this,
Mhm.
right? Like, we're talking about muscles that got
Yeah.
injured possibly
Right.
through birth. So why don't we rehab these muscles like we would do like any part of your body?
Mhm.
So that's, I think, one big one. Another one is, if you're a first time mom, you're going to necessarily tear and have a bad birth experience.
Mhm.
I can't tell you how many first time moms are in our program and had no tearing at all, or just like a minor first degree tear
Mhm.
for their first birth. Why? Because they have prepared properly,
Yeah.
right? Like, it's a bit like taking the sport analogy. If you're signing up for a marathon, would you just show up to the start
Right.
line without training? No, because then what happens when we do that? We injure ourselves. And that's kind of like written in the sky. Like, if you're not training
Yeah.
for a marathon and you're still trying to run it, you're going to injure yourself. Same thing for birth. We're talking about muscles having to do a very specific job that is very demanding, probably the most demanding job they'll ever have to do in their life.
Mhm.
And then we're expecting that they will perform like a high level athlete if we haven't trained them.
Right.
Um, so so if we do give them that opportunity to train, well, that's the results we can expect, is like they're gonna have less injuries. So that's one thing I want to emphasize, is like, it's not because you're a first time mom that you're going to tear to your anus and that you're going to have a
Right.
bad recovery. Like, this is possible to have a beautiful birth experience where you feel empowered, you feel confident, and you feel like you know what you're doing,
Mhm.
and that you have very good outcomes, and recovery after is so much easier when you don't have to recover from an injury, right?
Yeah. And I feel like that's such an important message and one that I wish more people knew because, I've had two kids now and I went into it. I had a medical phobia. So I went into it doing a lot of research, trying to just make sure for myself personally, like, can I navigate all this? Like, what are my plans? And I knew for me, like, I wanted unmedicated and things like that, if possible, just because of some of my own things I was working through. But so I feel like I researched quite a bit and did a lot of preparing, but you realize how, like, I feel like there's kind of two things that are really pervasive. It's like people have bad experiences and it's kind of like their badge of honor of like, well, it was, and they kind of like share those stories of like how bad it was. And that can be really hurtful for other people. And it just makes it be like, well, I had it bad, you're going to have it bad. And not really looking at like, how can we reshape that and help future generations not have these traumatic experiences. And then the movies, movies, TV shows, and like you watch the birthing experiences in these, and I just cringe because one, you internalize that, like as you become into an adult and you're like, well, that's how pregnancy and birth is, and it's awful and scary, and this is the only position to birth is on your back and things like that. And I just feel like we're like overcoming all of these really big things to try to help women feel empowered and not scared and say it can be a good experience. Like, sure, there's things that's hard. It's a lot. It's something you've never experienced before, but it doesn't have to be this like I mean, it's not this huge scary thing where you're tearing and being broken apart and all that kind of stuff. And yeah, I just feel like There's a lot, to overcome to help people really understand that and feel confident in it. It's not easy.
Totally. And I think also we live in an era where it's so easy to get these stories, right? Like you go on
Yep.
Instagram
Yes.
and sometimes
Yeah.
it's thrown at you even though you
Yep.
didn't really
Yeah.
want to hear
Yep.
it, or just like you said, like I think as soon as you're pregnant, people feel like somehow it's okay to throw their story at you even though
Yes.
you haven't asked for it,
Mhm.
give unsolicited advice.
Yes.
So so
Yes.
it's yeah, it's a hard time to live in. And I understand the women who when they're pregnant, they're just shutting all social media because
Yeah.
it can be very overwhelming, and it affects your mindset getting
It
into the
does.
birth room.
Yeah, I was
Because
very careful with what I would watch and like what even in my birthing classes, sometimes they'd want to show you a video of like this is how a nice birth could look like. It's like I don't know if I want to see any of those things because I'm in a good headspace right now and I don't want to mess with that. So
exactly. Yeah.
yeah, it's interesting. Can you share a success story or two about just some wins that you've had in this space and working with people?
Yeah, of course. I think one story that I would really like to share is the one of Caitlin. It's a client of ours in the program, and the reason why I can share her story is because it's on my YouTube channel, and we've done a testimonial interview,
Sure.
so it's public and it's out there. But Caitlin was a second-time mom. When she reached out to me, she just was pregnant with her second baby, and she had a very traumatic first birth that ended up with episiotomy and forceps, and she had such a long recovery. Like it took months for
Mm,
her to basically get back to normal
yeah.
um, because of pelvic floor issues. And so the second time around, like when we actually met to see if we wanted to work together in the program, she said, you know what, Sophie, I even consider scheduling a C-section because I don't want to add more trauma to my pelvic
Mhm.
floor. And it's fine, right? Like if I feel like
Yeah.
there's no bad or right way to give birth,
Yep.
and I was supporting her in that choice. I was like, if you want to prepare for a schedule C-section, we have support for this in the program as well. It's not a program where it's only for women who want to
Mhm.
give birth
Great.
vaginally. And C-sections, that's another myth actually, is like if you give birth through a
Right.
C-section, you won't have pelvic floor issues.
Yeah.
um, People are very surprised sometimes postpartum. They're like, well, I had a C-section and I'm leaking urine. Like, what is the
Mhm.
deal? So that's a whole other topic on its
Right.
own. But anyways, yes, that's kind of the spirit she was in when we first started working together. And she was like, you know what? I want to do the program to the T anyways, in case I get into labor before my scheduled
Mhm.
C-section. So I have the knowledge to, you know, navigate labor more comfortably than last time and be more confident. So she was not sure where she was headed. Did the program to the T, and she wrote to me, I think 3 days or 4 days before her scheduled C-section, and she was like, you know what, I canceled it.
Oh.
Because she felt like so confident in giving birth vaginally, and she ended up having like the most beautiful birth experience. I still remember getting her message because people share their wins on in our community, right? And when I read her post, I was like, are you kidding me? I started like crying
I bet.
because she was like, I had no tear at all. She said, I'm 3 days postpartum. I don't even need medication for my pain because I don't have
Mhm.
pain.
Mhm.
And she said that basically her second birth healed her from her
Yeah.
first.
Yeah.
How empowering is that? Like you
Yeah.
have
It's amazing.
trauma from a first birth, and your second birth actually healed you from
Mhm.
that. So I was like, this is just another example of how knowledge is power, right? Like she had all the tools, she did all the work, she put the efforts in, and she got the results. And
Yeah.
that allowed her to take care of a toddler as well. Because like that's the thing with second time moms, it's
Yes.
another
Yep.
deal postpartum,
Yes, it is.
right?
Yep.
It's if you do have a C-section, it's you can't
It's
lift.
hard.
There's a lot, like the recovery is much harder. And if you have another little one who's weighing like 35 pounds, 40
Yeah.
pounds, it can be really challenging. And same thing if you have a vaginal birth that doesn't end up being super good and you're in a lot of pain or symptoms after, it can be really hard to take care of your
Mhm.
family. So I think the motivation for second time moms is even higher to have a good recovery
Yes,
because they know
yeah.
how much more they have to do after the birth. So yeah, that was a huge yeah, a win for
Yeah, that's
me.
amazing.
Yeah,
Absolutely.
exactly.
Yes, yeah. Thank you so for sharing that, because I think it's really helpful to hear those stories. I know, just seeing stuff on social media, a lot of people who have experienced traumatic birth experiences, pelvic organ prolapse, things like that. They're like, "Can I even have another, pregnancy, birth, all of those things?" Like, that your foundation is so rocked, you don't even feel confident that you can pursue that if it was something you were interested in. So I think hearing these stories of how other people are able to face something that can seem really scary and truly traumatic, and come out on the other side and feel empowered and healed and all those things, I think it's really impactful for people to hear those stories. So thank you for sharing that.
Totally.
Thank you. Well, I know we're getting close to wrapping up. Is there something that you would like to leave us with? Like one thing you wish folks knew, or just some last parting thought?
Yeah, well, one thing is like if someone is expecting right now and they're like, yes, I want to do this. I want to like take care of my pelvic floor so I can have, the best birth experience and the best recovery. I am offering free consultations online to chat
Great.
with whoever is interested, and then we can see what your needs are, what your situation is, and we can see if we're fit to work together. So I can give you the link for
Yeah,
people to
perfect. We'll share it.
consultation. I've also got my YouTube channel, Beyond Birthing, where you can find a lot of free resources on there to prepare for birth, but also, the basic of what is the pelvic floor and what do we do with it when we're pregnant. So I
Mhm.
think that's another great resource to consult if you're interested.
Great. Thank you so much, Sophie. Yeah, and we'll share the links to those resources, and we'll have them available. So thanks so much for chatting with us today, Sophie. We really appreciate it.
Thank you so much.